There are various approaches you may want to try. If you're very suspicious, let's say for lactose, then you could certainly try and stop that first and see. There are tests to then confirm that. One common test is a breath test where you give the actual substrate you're suspicious of, and if they are able to make enough of a hydrogen or methane, then you pick that up from the digestion the bacteria do in the cecum. These tests are fraught with limitations, but nevertheless they are standard tests. Once you get beyond those, however, and many will need more testing, then you'd want to look at the actual enzyme activity. So there's a particular part of the small bowel, the upper small bowel, and the third part of the duodenum certainly would suffice. You can actually measure the enzymes that are responsible for some of the starch digestion. Other starch digestion is from the pancreas, which you can also measure, but that's less common. So when we do an endoscopy, we will go into the small bowel and take biopsies for disaccharidases. And these can measure up to 5 enzymes, depending on the interest. One is lactose, then it's sucrase, maltase, palatinase, and in some labs, glucoamylase. Independently and combined, these are all conditions that affect your carbohydrate malabsorption. And generally, you want to get that first because it's pristine, fresh, and the enzymes are not affected by any contamination from formalin. In the laboratory, it's a very old assay modified with the 40s that actually uses the appropriate substrate, and then the substrate hydrolysis makes a product, and then the product's measured. So the test is a simple principle, just much more refined and stable today. And the pretty quick results, and literally you will end up getting results even before you get to histology back from other biopsies you've taken, so it gets you the data at the right point. One of the things it does is increases the yield of your endoscopy. You'll probably find, maybe 15-20% of endoscopies may be abnormal in a general practice. If you add these, then you'll get another 10, 20, maybe 30% are abnormal and have much more effective care for your patients. We would often do disaccharidases, particularly in abdominal pain or in any symptoms where you have gas, distension, or malabsorption, as a routine. We're often surprised how often we find a positive sample that then makes sense, and we go back to the patient, the history becomes more clear, particularly when you treat that, and then it becomes more obvious. So I think it's true for many conditions where when they're anxious, puzzled, have an illness for a while, the symptom complex and the diagnosis are not quite that linked until more clarity. So we find disaccharidase is very, very helpful. One other thing that helps, which is very important, is if the disaccharides are normal, you're almost certainly not going to have celiac disease. So it gives you another validity to your histology. Pathologists are very good at celiac disease now, but they still will have to look very carefully at the villi and structures to call it. And if you have low disaccharidase, you may want to go back and ask them, can you just make sure one more time? And every year we still find cases of celiac that were not actually picked up the first look. So you've got another control that will let you know whether you're missing or not missing celiac disease, which is another very important reason to do them pretty much all the time. In principle, it's just like any biopsy. You want to do your upper endoscopy. When you do get to near the ampulla, you can either go right across it or below, somewhere in the third part of the duodenum. You can go further down, but that's not necessary. You want to avoid the bulb, though, because the Brunner's gland alter, and you often will get abnormal results that are not relevant to the patient. Now, you get the biopsies really as you would for a normal forceps, same normal size. If it's a small forceps or large, it doesn't really matter. We typically take 2 areas that can be very close to each other and put them in a Eppendorf type tube, a standard tube that does not have medium in it. When you collect that, our preference is to keep it in ice. Once it's in ice, you don't worry about it, and you keep it in a cold chain. Then it has more robust ability to stay intact until it's to the laboratory where we can then measure the enzymes. Again, we're somewhere opposing or below the ampulla. You can go further down, but this is the most consistent place. Open, close, and you want to take 2 biopsies, and again they can be next to each other. Open, close. So before you take the biopsies, you want to make sure you have your specimen container, like an Eppendorf tube, and then you also want to have some ice so that once it's taken, you can keep it in ice. The flicking is a very efficient way to get the samples in the tube, and doesn't take a lot of time. This avoids having to use forceps, which might damage the biopsy further. Then you go ahead and finish your endoscopy. Again, the key point is to get the disaccharide first so that there's no risk of formalin contamination.
This is a disaccharide sample. This sample gets placed on ice shortly after being retrieved from the patient. We here in our facility have only wet ice available to us, so we do place it on wet ice. You are able to place these on dry ice as well, or a freezer. Once this specimen is placed on ice, it must remain frozen for the entire time during transportation and arrival to the lab. We keep it on wet ice until we get a courier that has dry ice available to us, and from there it's transported frozen.
When it comes to shipping your sample to the lab, one of the most important things is that you recognize that the sample cannot be thawed once it's frozen. You may be grabbing the sample from wet ice and then placing it in the styrofoam shipping box where it will freeze, or you could be grabbing the sample from a freezer. If you're grabbing it from the freezer, make sure that your dry ice is ready to go because you do not want it sitting on a table to thaw. Once you gather all your samples, whether it be on dry ice or from a freezer, you can place them all in a single biohazard bag as long as that bag is able to lay flat. You could have 15, 20 samples in one bag as long as it's laying flat. The tube that the sample is in is called a primary receptacle. It has to be watertight. That will be placed in a secondary receptacle, like a biohazard bag, that is also watertight and sealed. Inside that bag needs to be an absorbent material. Right now I'm showing you gauze, but you could use paper towels or anything that will absorb anything that leaks. Once you have all of your samples in a bag, you can place it on dry ice in the box. The box I have here has styrofoam in it to keep dry ice, and it will keep all of your samples frozen. Make sure you put enough dry ice in the box that the samples will remain frozen during transport. This, I recommend, is no longer than 24 hours. Send your samples overnight. Close the styrofoam box. Make sure the lid is on tight. Sometimes dry ice can get stuck between the box and the lid, not creating a good seal. So make sure it's on there tight. Your box has to have a couple different types of stickers on it to travel with biohazardous substance. First, you want to make sure you have the dry ice UN 1845 sticker. On this sticker will indicate how many kilograms of dry ice you have, the shipper, and where it's going. You also need a UN 3373 biological substance category B sticker. This tells whoever's carrying it that there's a biohazardous substance in the box. You also need up arrows, letting the courier know and the receiver know which side is up. Once you have all those stickers on there, you can grab all of your requisitions for each patient and place it on top of the styrofoam box. This way the paper does not get wet from being exposed to the dry ice. With your samples inside, seal your box up with tape. With your box properly labeled, take a shipping envelope and put your shipping label inside. Close the flap and peel off the large adhesive on the back. Place it on top of the box. And take off that last piece of adhesive. Now you're ready to ship. To ensure that the samples arrive within 24 hours, I've already scheduled my pickup.
You'll be starting with your frozen biopsy samples. So the first step is to check the quality of the biopsy. You record the quality of the biopsy, how it looks, pale, red, or that kind of appearance of the biopsy. And then you're going to measure the weight of the biopsy. So you weigh it, and after that you're going to homogenize it in a required amount of buffer. After that, you'll be using substrate solution. So you'll be mixing this homogenate with measured amount of substrate, and then you incubate this in an incubator. Generally it is 37 degrees Celsius, and you incubate it for 15 to 60 minutes. And after that, you'll have to measure the activity. So when Disac enzymes acts on their substrate, that means when Disac enzyme, disaccharidases, hydrolyzes the substrate, it releases glucose. So you'll be measuring the amount of glucose released. So the next step is to use a plate reader to measure the glucose. And you express the enzyme activity in micromoles per minute per gram of protein. We don't recommend to rule out genetic predisposition if lactase is abnormal. In our own study, we have shown that CSID specific genetic markers are present in patients with abnormal or low lactase.